Hello, my name is Dr. Joanna Oda, and I'm an Associate Medical Officer of Health with Halton Region Public Health. Over the past several months, we've gotten several questions about the COVID-19 vaccine, specifically questions about the pediatric vaccine for children aged 5 to 11. Today, we'll be talking with some local experts to help answer your questions. Hopefully, at the end of this, you'll have the answers to your questions to help you make an informed decision for your child.
So some of the main risks of COVID-19, generally speaking, are like any respiratory infection, to potentially develop into significant lung complications, pneumonia.
In general, it is a mild viral infection for most children. However, some children can get very seriously ill.
What I found with a lot of patients, and even in kids and adolescents, is just that prolonged fatigue and the impact that it has on their quality of life. Certainly any respiratory infection can also develop into a systemic body infection.
We also know that some children develop multisystem inflammatory syndrome of children, or MIS-C, which is a severe disease often requiring ICU care.
Kids often spread infections to adults, right? Senior adults, adults like me, their parents. So it has an impact in terms of our ability to work, our ability to care for them, our ability to care for our other family members. So we do have to appreciate that when kids get an infection, it's not just them that we're worried about, but their families and their friends and the community in which they live and work. Kids aged 5 to 11 benefit from the vaccine, I think primarily because they don't get sick. So when they're not sick, they can continue to go to school, participate in activities, and that's what we're trying to do. We're trying to live with the virus. So if you're trying to live with something, if you can prevent it, that's the best way to live with it.
The COVID-19 pandemic has meant that children especially have experienced some of the most difficult disruptions to their regular lives. It's impacted their schools, it's impacted their ability to play with friends. And so protecting them from COVID-19 means that they'll be able to participate in these important activities.
The benefits of the vaccine significantly outweigh the risks of the vaccine, which are few and far between.
Just being able to live a normal, regular life is so critically important. So I see vaccination as an opportunity to sort of get back to that.
There certainly is value in getting vaccination after COVID-19 infection, because in time the immunity from natural infections does wane, and the COVID-19 vaccination strengthens the immune response and prolongs it against COVID-19.
Common side effects with the COVID-19 vaccine are frankly similar to many of the vaccines that we give to kids. Number one, you can get a sore arm. Number two, you can get a general malaise, potentially even a mild fever, but these are all mild side effects. When you think of the impact that the actual COVID-19 infection can have, these are very mild. With COVID-19, there's been a lot of information that's been shared. It's hard to know where to get the accurate answer.
So whenever you're looking at something on the web or that was forwarded to you, it's always important to double check where it's coming from. Is it from a reliable source? Is it from a scientific source like the Public Health Agency of Canada, Public Health Ontario, or an international organization like the World Health Organization?
The first thing I always recommend is talk to your doctor or a health professional, nurse practitioner. They have the resources and they can guide you. They can give you some of the answers that you may need. The public health website is a fantastic resource, and I would encourage people to look at that resource as well.
If you're looking for reliable sources, you can find a list at halton.ca/COVIDvaccines, and you can always talk to your healthcare provider with any questions.
I would recommend that children 5 to 11 get vaccinated against COVID-19.
I would recommend children 5 to 11 get the vaccine because it's our best way of protecting them, trying to get back to a normal life, and trying to protect all our family and our friends and the community at large.
I strongly recommend the COVID-19 vaccine for children aged 5 to 11. It's safe, effective, and it will protect them and allow them to continue to participate in important activities.
The COVID-19 vaccine is a very good vaccine. And I try to emphasize with patients and families that it really reflects the concerted effort of doctors, scientists, administrators, everyone working together to really develop this vaccine. So follow the guidance, and that's the best advice I can give.
There's a lot of information out there, and we're all trying to make the best decision for ourselves and for our loved ones. Make your decision based on reliable information and keep asking questions. We'll keep talking to experts and helping to answer those questions.